Hello everyone, I'm Dr. 𝒂�わ𝒁𝒂𝒊𝒏𝒆, your prenatal family chiropractor serving Macomb and Sterling Heights areas of Michigan. And today we are going to talk about neck pain. So neck pain is a very common issue that people associate with chiropractic care, that and like low back pain, things like that, which we see great results with. So we're just going to talk about what are the causes of neck pain, and then how we treat that, and just some general stats that go along with neck pain. So obviously your neck, one of the main functions of your neck is to hold up your head. And your head around, in the average population of adults, is around 12 pounds. So you can think of like a bowling ball constantly sitting on top of your neck. Your neck is always having to structurally hold that up. Also in women, we have complain of neck pain 1.5 times more than men do. And that's just because that's where stress tends to settle in the female body, is up in the neck area. With men, it's usually in the low back. And it's important to address your neck pain because 30% of those cases of neck pain turn into chronic issues. So that's why it's very important to get that fixed right away rather than waiting. And that's how everything goes with your health. It's always better to be proactive with your health rather than reactive. And so neck pain nowadays, a lot of times, is caused through lifestyle. So one of those is poor posture. Nowadays, we tend to go looking down always on technology on our phones. Even in kids, we're seeing, we call it tech neck. We see that in young as like pre-teens nowadays, just because people get started on that technology train very young age. So this is a problem that we are seeing a lot of now. And around 4 hours a day is what the average adult spends on their phone. So this structurally is very bad for the neck because you're always looking down. So you're making that curve in your neck go the opposite direction of what it should be. So that's one major cause of that. Another cause is sleeping positions. So a lot of people tend to go for the belly stomach position. So just because that's the most comfortable position they can get in. And that's very bad for your neck because, again, you're rotating your neck, and then also on that curve where your curve should be a C shape, you're reversing that. So that's another issue. Also, another one is just poor biomechanics. So poor movement, structurally, just having that weak muscles in your neck, and then also having the no motion in your neck. So that's what we do with chiropractic here, is making sure that you have the proper motion and proper structure in your neck spine, that area, so that you can move and your body can connect to the brain, send those signals easily to the nerves there, so that everything can function and work properly. So if you have a lack of motion in the neck, that will eventually then lead to degeneration processes. So if there's no motion there, the body's going to start laying bone down in that area to try to protect it. And also, we see that a lot with reverse curves in the neck. So the body's trying to stop that process from getting worse, and so it starts going into degeneration processes. And this is not good because once it keeps going, progressing, eventually there won't be any motion there, and then that will inhibit on your daily life. So that's what we do with chiropractic, is trying to get the proper structure in your spine. Also with, that goes hand in hand with function then. And then also getting motion in to your neck there, because if it's not moving, then your brain is not getting those signals to that area. So the neck should be this nice reverse C-shaped curve, like I said. And that's important because all of your spinal nerves that come out through your spine here, these yellow things, if that curve is not sitting properly, then that causes a lot of tension and stress on these nerves and also on the spinal cord that runs back through here. So that's what we address with chiropractic care, is getting motion into the neck, making sure everything's moving properly, making sure the structure's sitting where it should be so that your nerves can communicate back to your brain and that there's no interference to that nervous system there. And another thing along with chiropractic care that we do to address neck pain is we give our patients stretches to do. Also, it's important to get that C-shaped curve in there, so we also have these special molding rolls that patients will lie on and help to change the ligaments, the muscles in that area to slowly start getting back that curve that you need in your neck. So that's what we do with chiropractic care. Go ahead and share this video with someone that you know that has neck pain or someone that you know that could benefit from this, and we'll see you next time.